Hi, Dr. Kerry. I'm going to vlog my November articles. The first one I read is heart failure and the correlation between heart failure and in poorest counties. Heart failure deaths in poorest counties. The study examines the correlation between poverty and heart failure in American citizens. The research data from 3,000 counties in the U.S. state that for each percentage point increase in poverty, the heart failure mortality increases by 5.2 deaths per 100,000 county residents. What the study also found is that two-thirds of the effect of poverty on heart failure and mortality was due to rates of diabetes and obesity. Another factor is also unavailability of physical exercise regimen and no access to primary health care. The study also focused on 5 socioeconomic variables that could also lead to poverty and increase in death and mortality rates. The first one is median county household income of the county, the unemployment rate in the county, the proportion of the population aged 25 and older without a high school diploma, the proportion without health care. The study also looked at that the more poor you are, the result of the study is that the more poor you are, the more you are susceptible to the more susceptible you are to heart failure and death. Another article that I read is the correlation between suicide ideation in transgender population. The correlation between the correlation between suicide ideation behavior among transgender people. So the study explores the fact that transgender people are at a higher risk of suicide ideation attempts and death compared to the rest of the population. Transgender people are underrepresented and understudied. There is not a lot of research that is looking at all these factors in the transgender population. A good population of transgender suffers from some form of mental and physical health due to a lot of factors. Some of the factors they identify is discrimination, abuse, assault, and all different sorts of racism. The result of the study suggested a complete policy and clinical recommendation in addressing the hardship experienced by transgender people at the macro and the micro levels in their environments. The study also urged therapists to factor in the intersecting identities of transgender and their relations to suicide ideations and attempts. Some of the factors that we are also studying is education. Lower level of education of transgender individual is more likely to attempt or have suicide ideation than those transgender with college degrees. Another factor is external minority stress, which is the physical, sexual, verbal aggression, and discrimination being experienced by transgender population. Another factor is age. Another factor is social support. So the study examines the social support, being that the transgender individual that has a better support from family and friends are less likely to have suicide ideation or death or attempt to kill themselves. Compare to those that does not have social support, those that are rejected by their family, they are more likely to attempt to have a suicide ideation or to attempt suicide death. And another book I read, another articles I read that I'm going to spend an ample time on is coronavirus and how it has affected the country, and and also the racial disparity from state to state, and how the response to coronavirus in different states, especially the states that are mostly populated by minority and people of color. So coronavirus really exposed the disparities in healthcare between wealthy Americans the poor Americans, and even people of color and minorities. Communities of color across America are being hit disproportionately when it comes to healthcare accessibility. Nationally, African American deaths are 2 times greater than would have been expected due to their sheer percentage of the population. In 42 states also, Hispanic Latinos make up a greater share of the confirmed cases than it should be considering their share percentage in the overall American population, while white people deaths are lower than their share of the whole overall American population. I look at the statistics from state to state, and I wrote down a few states. One of them is Wisconsin. In Wisconsin, 141 blacks died, which accounts for 27% total deaths in the states, where the population of blacks is only 6%. So 27% died. That's account to the 27% in the whole state, and the state only has 6% blacks. Again, same with New Mexico. New Mexico, 60% of the people that have COVID are Native Americans, and they're only 9% of the population, but they account for 21% of the death. In South Dakota, same thing. Asian Americans are only 2% of the population, but they account for COVID cases. They account for 12% of the COVID cases. So definitely, and another thing we found out is that minorities community are less likely to be tested for COVID because nobody really care about them. The pandemic brought the racial and ethnic disparities to the surface, a structural discrimination that has limited access for Black and brown people to healthcare and wealth, dismissing lives of people of color as if they are not human beings. And it created something like it is them against it is this us versus them, or them and not me problem. It is them, it is the Black people, it is the minority that are having the problem, it's not me. So another thing I looked at is the social distancing. Excuse me. Social distancing is a privilege when you have to share a room with your other siblings. These are for the minorities. The rich people don't have that, or the white people don't have that. Most of their kids have rooms. People that doesn't have a room, they have to share with their family, especially minorities that are also running from the law, like undocumented. Some of them are like 5, 6 in one room. So social distancing is a problem right there. We will not get the result and the horrors that we all, in one way or another, experience with COVID until we are able to get rid of the pandemic. And researchers go to work and create data that educate us on how future pandemic like this will factor in how to cater for minority groups and also address the big disparities in accessing healthcare. Because right now we have limited data since COVID is still going on to support a lot of the findings that we are reading on. I am a big example with COVID. I had COVID, and I definitely knew that the care I got, the quick access to healthcare, and the level of healthcare I got to be able to survive, especially because I'm an at-risk patient, I have asthma, have a lot to do with how quickly I recover compared to someone else who doesn't have my kind of privilege or my kind of access to healthcare. I went through the COVID. It was bad. It was horrible. But the consolation for me is because I have a good healthcare and I also have money, or I'm comfortable to be able to take care of myself. Now, how does that look for those that couldn't? And that really, really hurt my heart, so much. So I know that I really have all the advantages and privileges to healthcare, and that's one of the key why I do survive it, because I'm an older woman. Age is not on my side, nor having an presenting or underlying ailment like asthma. That's not on my side either. So, but So thank you, Dr. Kerry, and have a good day.